It's official, starting midnight on Wednesday, Malaysia's capital Kuala Lumpur will go back into a strict lockdown as the country battles a huge spike in COVID-19 cases. The movement control order banning social activities and gatherings will be in place for 2 weeks until January 26.
And it will not just be in KL. The MCO will apply to 5 states: Malacca, Johor, Penang, Selangor, Sabah, and the Federal Territories of Putrajaya and Labuan. In an address to the nation this evening, Prime Minister Muhyiddin Yassin explained the need for the tougher restrictions.
The situation today is indeed very alarming. Our healthcare system is under tremendous pressure now than at any other time since the start of the pandemic. And I've said before, unprecedented situations call for unprecedented measures.
Besides the MCO for 5 states and the Federal Territories, Pahang, Perak, Negeri Sembilan, Kedah, Terengganu and Kelantan will be placed under the less stringent conditional MCO, while Perlis and Sarawak will be placed under the recovery phase of the MCO.
The Straits Times Malaysia Bureau Chief tells us whether it's the MCO, CMCO or RMCO, the new restrictions should come as no surprise after a third wave of the infections hit Malaysia hard.
I think many Malaysians saw this coming when numbers started to spike from a few hundred to 1,000 to 2,000, and last week we went past 3,000 in one day. A lot of people started talking about whether further restrictions would be reimposed. Now, there was also word leaking out from official sources that the Health Ministry had recommended returning to what we call an MCO, and this was subsequently confirmed, and we know that Prime Minister this evening announced that 5 states and all federal territories will return to an MCO. So it didn't really come as a surprise. In fact, many people were waiting for the announcement and were basically saying, if they're going to do it, why don't you just tell us earlier? Because a lot of people were expecting something to happen at the end of last week. And some Malaysians were quite upset. They had to wait till Monday to find out what was really going to happen. The government, Muhyiddin's government, earlier on has been credited with doing a good job of handling the crisis. Numbers went down to single digits in June, in July for several months, but then it started spiking up again. I think there was a point where 9 out of every 10 Malaysians polled said the government was handling the crisis very well. I'm not sure if you polled Malaysians now that you would get such high approval of the handling. But that said, I think Muhyiddin was left with no choice. He had to reimpose the MCO, not simply because of the numbers, but because, as he said, our healthcare system is under strain. We have something like 28,000 beds that are set aside for COVID-19, and as of yesterday, 27,000 were occupied. So we are very close to the brink, and if we can't bring the number of active cases down, then we're going to end up in a situation where patients can't be admitted to hospital, and that would definitely increase the death toll.